And so also one of the studies that I was interested in recently that I did was looking at the immune kind of response in the peritoneum. And what this study that I did showed is that a certain type of immune cell called a macrophage. So these macrophages are cells that kind of patrol their environment, and if they find something foreign, like a cancer cell that doesn't look normal, or a bacteria or something like that, they generally tend to eat it, process it, and then present those kind of proteins to other cells to say, hey, look out for this, so that's one type of macrophage. And the other type of macrophage tends to quiet down or slow down the immune system. It's suppressive, immunosuppressive. And that's to prevent the immune system from going haywire and causing kind of autoimmune or inflammatory, side effects the other way. You're trying to find a balance where you want the immune system to clean up and find abnormal cells that could be cancer, but you don't want it to attack normal cells. And so ideally, this lives in an equilibrium, but what we showed in this study was that having more of the immunosuppressive, those quieting down, tamping down macrophages floating in the peritoneal fluid in patients with gastric cancer, we found that that was prognostic or predictive of worse survival. And so to me, that makes me think, is there a way that we can change these macrophages back to their inflammatory type? If they're associated with worse outcomes, is that an opportunity for a possible immunotherapy in the peritoneum? And, I don't think it's just me thinking of this, but I think that, when we think of what drug to give in the peritoneum, I think we should be open to all of them and not, solely chemotherapy, cytotoxic drugs, but maybe immunotherapy or even targeted drugs.